tidak bisa keluar. Terus akhirnya kan dia konservasi penyerapan mikronutrien terus ini antropoides bisa sepsis. Iya, ini nggak yang paling ini biasanya standar.
Tapi ini kejadian ini genetik atau bagaimana pewarisan itu?
Genetik. Iya, genetik. Dia enggak bisa resesif, bisa dominan, dia tidak spesifik.
Resesif berarti kemungkinan kan ada yang
Iya. Berarti ini the project aims to determine by the year of 2017. Atau mungkin ada istilah antropometri yang apa?
antropometrical assessment atau antropometrical assessment. Biasanya
karena kita mungkin ngambilnya kan nggak semua, kita ambilnya vitamin A aja, karena yang berperan pada genesis vitamin A yang berkali pada penelitiannya.
nanti di screening
Tidak apa sebetulnya lebih gejalanya.
Buatnya kan developmentnya.
based on hospital and community based.
Based on hospital and community.
Ya. Saya ketemu Budia bilang dia YKI.
Itu yang mata diceritakan itu sejak 2013 Mas.
yang setingkat kampung-kampung wisata yang ada di sekitar kalau di lain itu ini dia maju kalau jangan itu misalnya jajah dengan kampung wisata di Belanda aja di kampung wisatanya namanya yang Volendam itu standar. Saya lihat Volendam itu kegiatannya membuat itu kan.
Sekarang objektif, jadi yang lebih khusus. Jadi apa aja satu proses.
Tiga kalau diomongin, diomongin. Kita juga perlu. Iya. Dan ditambahin.
Terus air.
Ya, in order to improve and other corneal disease. Jadi aku ya, lagi aku ini inventory of the chemicals, develop the inventory of the, mau inventory ya.
Develop inventory of the chemical hazard of the pesticides.
Oke. Yang kedua, prevalence of occupational skin disease, terus especially occupational contact disease. Ya, ini ada wes ngomong occupational skin disease, mesti nek tiba-tiba ketemu apa wes mlebu.
Oke, tadi yang dan ada alergennya itu maksudnya
Masuk.
apa bahasanya?
Ya aku mau.
And the allergen
Kalimatmu
and the
sampai.
responsible
Ya.
allergens. Prevalence of occupational skin disease, especially contact dermatitis and the responsible allergens.
Ya.
Right, sekarang Niro, enggak dok? Timbalnya atau
berarti desainnya tuh long term ya, cohort gitu toh. Ya, diamalkan. Ya, deteksi dini ya. Kalau misalnya ada sesuatu temuan, baru diteruskan.
ini proses tentang
Sampai mati dok, oke. Seperti pandemi ada pengaruhnya. Ya, itu sih
Lebih spesifik ya.
Nah, ini jangan terlalu luas. Ini in general, tapi kan kita ada spesifiknya. Ada tiba-tiba nemu sing liya lagi. Supaya fokus. Iya. Jangan terlalu luas, jadi kok bingung nih gawe. Karo para apa instrumennya lebih luas. Objektif ya.
itu sama kalau mata barangnya proposal kita tuh khususnya. Pesticide exposure to peripheral neuropathy.
Yeah. Okay.
Objectives by 2018, assess the correlation of pesticide.
So you only have less than 10 minutes to present your idea. And I will cut you if you're more than 10 minutes, okay? And then they will respond to your request for your support or whether you need to improve certain aspect of your proposed plan, okay? So, but Laras is going to decide who goes first. Who goes first? Group 1. Who's group 1? We didn't assign number, but somebody claimed to be group 1. That's okay. Pesticide group, okay.
I believe it will be less than 10 minutes, so I hope I don't take much of your time. So the title of our project is The Effect of Pesticide Exposure to Neurosensory and Skin Health in Ngablak Magelang Regency. So we have a very dynamic team. So our team consists of me and Dr. Cempaka from Neurology Department. And then we have also someone from the Dermatology Department, Dr. Lia over there. And also we have Dr. Panji here from the Ophthalmology Department. So we try to design a research which can collaborate the expertise of all these peoples. And then we want to create something which is actually relevant to the situations that we have right now in Jakarta and in Indonesia in general. So then we came up with this idea, effect of pesticide exposure to neurosensory and skin health in Ngablak Magelang Regency. So why we take this topic? First, Indonesia is an agricultural country with so many farmers all over Indonesia. So the issue of pesticides use and health is something which is really relevant, which is really going on right now in this country. And this Ngablak area is already quite famous. There are already some research from some university in Indonesia to identify problems related to pesticide use in this region. And one research interestingly published by the Diponegoro University on Semarang found that 70% of the wife of the farmers are actually intoxicated with pesticides in this area. So that's why we try to develop a proposal about this. And the project statement, why is in order to provide information about the effects of pesticide exposure to neurosensory and skin health among farmers, their family, and surrounding community by 2018. And next. Oh, okay, sorry. So the project goal is to provide information about the effects of pesticide exposure to neurosensory and skin health among farmers, their family, and surrounding community to contribute to increased health status for the farmers and the community. So it's not only the farmers who will get the effects of the exposure to pesticides, but it's also the family, because the family, the wife especially, usually come together with the farmers, together in doing the spraying of those pesticides. And also after the pesticides is used, the leftover of the pesticide is usually will be brought by the river streams, which the river will be used by surrounding community. So it's very relevant that the community is also involved in this research. And So the objectives is by June 2018, we want to assess the correlation of pesticide exposure with neuro-ophthalmology diseases. We want to assess the correlation of pesticide exposure with corneal diseases. We want to develop inventory of the chemical hazard of the pesticides. And then we want to identify the prevalence of occupational skin disease, especially contact dermatitis and the responsible allergens related to that. And then we also want to assess the correlation of pesticide exposure to the mother, pesticide exposure to the mother with cognitive impairment to their children, especially for attention deficit hyperactivity disorder. And then we also want to assess the correlation of pesticide exposure to peripheral neuropathy. First is that we want to identify the prevalence of neuro-ophthalmology diseases among these farmers exposed to pesticides. And then we want to identify also the types and the stage of these diseases in the farmers exposed to pesticide. And the next one, we want to, for the second objective, to assess the correlation of pesticide exposure with corneal diseases, basically the same with before. We want to identify the prevalence and also types and stage of this disease related to pesticides. And for the third objective, to identify the develop inventory of the chemical hazards, and so the indicator is the chemical hazards are identified. So identify in the laboratory what are the contents of the chemical, how dangerous they are, and so on. And then the objective 4 is to identify prevalence of occupational skin diseases, especially contact dermatitis. So we want to identify the prevalence of this disease as an indicator. And then the fourth objective, to assess correlation of pesticide exposure of moderate to cognitive impairment in children, we want to identify the identification of prevalence of cognitive problems, especially this ADHD in the children of the farmer's family exposed to pesticide. And then the objective 5 is to assess correlation of pesticide exposure to peripheral neuropathy. We also want to identify the prevalence of peripheral neuropathy among those patients exposed to pesticides, and also the severity of peripheral neuropathy of the farmers, and of course try to develop a correlation between them if they are available. And then the objective 6 for the capacity building, we've spent much of our time to discuss about this actually, about how confident we are in producing this. So we want to develop human resources and infrastructure to enhance occupational disease related to pesticides. We believe that in the amount of 3 years, we can at least, we are not sure whether we can produce a PhD, because 3 years is 3 years. So, but we believe we can produce 1 PhD proposal for that. 6 undergraduate theses, so scripts can be produced. 6 MSc students or residents could be trained, and 5 international publications at least. And the health cadres will be able to identify the early identification of neurosensory and skin problems related to pesticides. And also, we want to produce a book, some kind of guidebook for the health cadres related to this problem, and then like how to do self-protection for the farmers and things like that. And then farmers in the location understand the importance of self-protection to pesticides. So the main steps, finding grant, of course, seeking approval, study site preparation, field studies, laboratory analysis, including cholinesterase examination to see the level of intoxication in the patients, acetylation status, which will be related to genetic examinations in the patient, chemical identification itself, which will be related with toxicology examination to identify what are actually intoxicating them. And then supporting examinations to see whether these pesticides already cause some disease which cannot be identified only by clinical examination. For example, by peripheral nerve examination using electroneuromyography, the expert is here, Dr. Asmedi, and then neuro-ophthalmology examination including perimetry, and the examination of skin testing and skin examination. And data management, reporting, capacity building. So main steps for finding grant is, of course, proposal development and grant application. Seeking approval, create a protocol, the case report form, and informed consent development, develop the questionnaire, and then ask for ethical approval from the ethical committee, and also discuss with the local government to gain their approval. And then the third step, study site preparations, arrangement of transport, recruitment of field training staff, provision of the materials, and then the field studies, including the questionnaire filling themselves, and then clinical examinations in the community for screening, and then the patients that we found to have these problems will be further examined and surgery to hospital. The main step 5 for laboratory analysis, of course, preparing the reagents that we will need for those all things that I mentioned before, and then also preparing the lab equipment which will be needed either for this skin testing and also for the genetic testing and so on. And then blood samples collection, analysis of the blood samples, and then the analysis of the data. For supporting examinations, we perform examination of patient and surgery to hospital. And then the data management, including the data input and data analysis, and reporting, including research report, including budget report, and then producing international publications with 5 targets that we mentioned before, and the capacity building with students recruitment to become PhD or master students, or recruiting residents, or recruiting undergraduate students to join in this research. And then development of the proposal from students will be a subtopic of this big topic that we create, and then production of the student thesis, and then production of the book for the cadres that we mentioned before. So that's basically it. It's a big honor to present in front of you, and I hope it can be accepted. Thank you very much.
Okay. Do I need to start with a disclaimer? Because if I say this project is interesting, then next week they will come to me with the real proposal. This is part of how the faculty will help the district government to improve the health of the people. Now about this topic, my immediate response is that I think we can also involve, it would be interesting if we could also discuss and have, invite researchers from, for example, other faculties, where maybe they could have more in-depth on, I don't know, either biology or maybe agriculture, chemistry, then they can also develop that more, the part on the pesticide exposure. So that's my first. I also have some questions. Am I allowed to ask questions? Yeah. I'm thinking about the goal even further, because we often said that we do research not just because we want to publish, but we want to really do something with the community. So I wonder what would be the longer term goal in terms of prevention. And
maybe later my group can add, but one of the things that we will that we mentioned actually here is that the final end that we want is actually to create a more safer farming. What kind of pesticides are actually causing this problem and so on. Of course, the end results, besides the publication, is also the recommendation. So we know that this type of pesticide is dangerous, this type of pesticide is dangerous, so that we can recommend that for later years they can try to identify a safer pesticides that can be used in the farming, which will not be detrimental to the health of the people.
Yeah.
Maybe it's more like, there is a standard equipment that the farmers should have when they do spraying of pesticides for their self-protections and everything. Thus, in some village have different way of doing that. Some are provided by the local village community. Some are, each of them have their own tools and stuff like that. So to be able to achieve a better farming, which is safer for the people, first we need to have all those equipments ready. And all those equipments ideally have or possessed by each farmer. So for example, they need to have masks, they need to have the goggles, they have to nets, to have the special jackets for that. They need to have a safe spraying environment themselves, and there should be the infrastructure to provide the safe pesticides themselves, because they get what they have in their place. So the pesticides which are produced, which is safe enough and cheap enough so that they use that, so which is effective enough. But the safety we don't know. So if we talk about infrastructure, the development of these pesticides, safe pesticides themselves, is probably important. But we don't mention it here at all.
yeah, one also quick question is, I'm interested in one of the outputs that you will have at the end of the project, which is the health cater book. And I'm not sure, because before we come up with this health cater book, there must be a process or a research or whatever area that, so at the end we could really empower the health cater. So that point I think is very interesting. So I would encourage you to identify researchers from that area, agriculture, and I think this will become a very important project, very interesting project. Thank you.
Thank you, Vice.
My group leader want to add something.
Okay, short, because Vice Chancellor is busy. He's waiting.
What's the size of the problem that you're dealing with here?
Okay, thank you very much for the question, Mr. Vice Chancellor. So the problem of pesticides in Ngabla, like I mentioned before, is actually not a new problem. It's a problem that have been mentioned before in some publications by our colleagues from other university, but unfortunately not from our university. So the population is quite big in the whole populations. I don't really remember, but it's quite a big populations, and most of them are farmers. And one research that I mentioned to you, which is produced by our colleague from other university, shows that he doesn't examine the farmer themselves. They examine the wife of the farmer, and they find that the choline extract level for 70% of them are not normal related to this pesticide intoxication. So we can imagine the level in the farmer themselves could be higher than that. Okay. So considering this big number of populations, this big number of percentage of intoxication, we think it's needed to see whether it really affects their health or not. So that's why we come up with this idea.
Okay, that's good. That's helpful for the background to the study. I agree with the need to engage the agriculture faculty with this project and the pharmacology department with, or the pharmacy area or the chemical area, simply because I imagine that there are variations in the level of pesticide use between different farmers, the timing of their pesticide use. All of those things will need to be covered, and I think you'll need expertise on your team to really define that very, very carefully. I also think that you're going to need quite a deal of expertise in two other areas which you didn't really cover. One of those areas is epidemiology, and the statistics issues that will surround the whole survey instrument. How many surveys do you have to distribute to get a meaningful result? You'll need some statistical advice on that and epidemiology coverage. You also mentioned that you're going to be looking specifically for ADHD in the children of mothers of farmers. Now, what expertise do you have on your team to be able to analyse whether a child has ADHD or not? Do you have a neurological expert on your team?
Yeah, Dr. Champaka thesis is related to ADHD in children, so he's quite good in doing that. But of course, I agree that this is, because we have 4 members in our team, so then we put what we have here as our expertise. But this actually needs a much larger people to contribute, including what you mentioned before, chemical and agricultural, and also the public health department themselves, I think, for the epidemiological perspective and
that's
so on.
good.
So,
that's good. Now, you're looking for the prevalence of ADHD amongst the children of farmers, compared to what?
Okay, so we want to see the correlations of this exposure to these pesticides in the mother with the ADHD in the children. So then we want to see whether there is a correlation on that. So we will, 2 things we will do, checking the ADHD in children, and the farmers, and then probably we'll need some control groups, definitely. But after that, we will need
it's the control group that I'm asking for here, simply because you will need to know what is the prevalence of ADHD in children born to mothers who are not exposed to pesticides.
Yes, we agree. Yes.
So that, in a sense, could double the size of the survey that you have to do.
Yes.
So you'll need to be prepared for the statistical analysis, which allows you to draw the conclusion that you think that you're looking for, and so you'll need some care on that. And I think Adi's question about infrastructure was very important, because I think you answered it in the context of the farmer. I'm asking you in the context of being a vice chancellor, what infrastructure do you have in this university to allow you to do all the tests that you are going to run? How costly are those tests going to be? Do you have the equipment to do that?
Okay.
So is that going to be part of your grant application for funding for the project?
Okay, and that question will need some answer together. Maybe I will answer first about, there are some examinations we'll perform here by the neurology department, ophthalmology department, and dermatology department. So then we have all the required instruments we have, either in the medical faculty or in the Sarjit hospital. But yes, some of them are quite expensive. We mentioned before ENMG, it's around 400,000 rupiahs per person. And then some other examination will be around that area. Genetic examination will also need some 100,000 per person. Related to the ophthalmology and dermatology, maybe ophthalmology first, the perimetric examination, how much do you think?
If we find that something happened in that result, we send to the Sarjito General Hospital.
For perimetric examination.
Today,
how much do you think it will cost?
Today, almost all people have, insurance, health insurance, so it's free for examination.
Great. And then the dermatology department, maybe you want to add something about the cost of the examinations.
Okay, let's not spend time on that now. We could go into every level of detail.
So basically
here.
we have everything in our...
But the one final comment I would make is, in preparing your application for funding, what I'd suggest you might think about is considering dividing this project into 2 phases. In other words, the first phase is an exploratory phase to really try and get a handle on how common is this problem. And then secondly, go into the more detailed scientific work if you can identify that there is a problem that you can actually answer. Okay? Because you need to know whether the size of the problem is here. You've got a complete project written up here. I'm suggesting maybe think about that in 2 phases, because the money... The university, Adi, the university is very positive about your project, and we would support you going forward. But the funding agency that you're going to approach is receiving a lot of proposals. There are 3 other proposals that we haven't heard about yet. And the funding agency doesn't have a lot of money, so they may ask you to divide this up into 2 stages. Exploratory in the first stage, maybe for a year or 2, and then the more complete study over 3 years later on.
Okay.
Okay.
Thank you very much.
Well done.
Vice Dean and First Chancellor.
Group 2, which is Hirschsprung. We know who this is.
Actually, we don't have really struggle to make agreement among us, 4 of us, since we have only 30 minutes to make assignment. So no struggle at all. And why we choose such a project? Since our pilot study, Hirschsprung disease, have incidence almost twice in Indonesian compared to Caucasian. And then the second reason is the morbidity and mortality, if delay diagnosis is very high. Then we conclude to make a project, Indonesian Hirschsprung patient, we will perform from diagnosing, genotyping, nutritional status, and EEG profile. So our project statement is in order to provide critical information for development of early diagnosis. So we emphasize on early diagnosis. Actually, for diagnosis Hirschsprung is already established using histopathology by surgery, of course, but we want to make a tool, early diagnosis, to prevent the morbidity and mortality of Hirschsprung by combine between genotyping, nutritional status, vitamin A, and EEG profile. Slide. Our goal already mentioned in previous that to make early diagnostic tool for Hirschsprung disease in Indonesia first. Slide. And our objective first, to know the genotype of Hirschsprung of patient and control, of course, and then to know nutritional status, and to know the EEG profile, and the last one is to develop human resources on Hirschsprung research in Indonesia. Slide. To achieve our first objective, our indicator, we perform genotyping. We have infrastructure in our university. It's already going on, and then this research is already pilot study. So we have human resources and we have infrastructure. Next slide. For the second one, to achieve objective to the international status of Indonesian patient, we will collaborate with Dr. Janatin from anthropology to measure the anthropometric, such as weight, weight circumference, skin fold thickness. Why we do need such measurement? Because if the patient with Hirschsprung we diagnose late, then the patient becoming malnourished, and then stunted, even death. Slide. And for objective number 3, we will collaborate with biochemistry staff, Dr. Pramuji, to measurement, because one of pathogenesis, interestingly, actually Hirschsprung disease is multifactorial disease combining between genetic factor and environmental factor. But so far, only vitamin A convinced that have a role in pathogenesis of Hirschsprung disease. So that's why we focus on vitamin A measurement in patient and control. And for the last objective, to develop human resources, by the end of year 2, we hope we will have 1 PhD, 2 master, 1 and 1 postdoctoral, and also we already have the Hirschsprung disease collaborative study international with PI of Johns Hopkins University, and then we already as a member of Hirschsprung disease collaborative study, and then hopefully we will have transfer of technology from Johns Hopkins to our university and our hospital, such as electrodiagnostics tool, EMG, etc. And then this is the main step and breakdown. If you see in the next slide, maybe more, this one is our plan, 2 years from seeking approval, first making protocol until informed consent. I think it takes 4 months, and then at even ethical approval, we will plan for 6 months. And then after that, we also have plan for MTA, Material Transfer Agreement, because it can be we transfer DNA to Johns Hopkins or Johns Hopkins to Indonesia or from other researcher. Because in the collaborative study, there is statement that we will share DNA material genetic. Also, we will share data, patient data among researcher in that collaborative study. And then transfer fund for study site preparation, we need 4 months for training staff, also for material or equipment. Next slide. And for recruitment, the patient and control, also for Laboratory experimental, we need from the month 7 until 2 months before the end of grant. And then of the last 2 months, we will perform data analysis and manuscript preparation. So it means that infant mortality rate doesn't reach the goal of MDGs. And then post MDGs 2015, we have cardiovascular disease, and one of them is genetic disease. So until now, genetic disease is always neglected by government. And then instead of one of the most common genetic disease in neonate or children is Hirschsprung disease. As I mentioned previously, that the burden is very high. Even our previous publication show that the incidence of Hirschsprung is almost twice compared to Caucasian. So the burden itself, genetic disease for the infant mortality rate around 10% for infant mortality rate.
Okay.
Yeah.
And if we are able to detect or to do early diagnosis of Hirschsprung, does that mean that, for example, surgery is not necessary, or what would that imply?
Surgery until now is definitive therapy. So what we want to achieve in this project is to prevent the complication due to late diagnosis, and then make surgeon is more easy to perform surgery, and then more minimal complication post-surgery. That's the purpose.
Okay, and could you give me an insight of how often that difficult complication occur?
Very often, around 20%.
Areas related to Hirschsprung in which we could develop further with other researchers?
Okay, maybe I will ask my colleague, Dr. Pram or Dr. Asmedi, to add.
If a family is identified to have, because it is a genetic disease, so if a member of the family could be identified as has this Hirschsprung, and then it wants diagnosed, or it wants, we can't prevent the psychology.
I understand.
Yeah, okay. Thank you.
Thank you
for your suggestion. Vice Chancellor?
Thank you very much. Another interesting project. I guess my main question is related to an area I don't understand about this disease, and that is when does it become manifest in a patient?
During embryology, the 5th and until the 8th of weeks gestational age, the neural crest migrated from foregut until hindgut, and then if the stop in the midgut, it's very long.
Okay.
And then it's manifest earlier. Even neonates after birth, they don't have defecation at more than one day.
Okay.
That's the manifestation.
So, all right.
Yeah, because we want to follow up the anthropometric status. Will be conducted by Dr. Janatin. How do the anthropometric after surgery? We follow up at least 2 years.
After surgery to fix the disease?
Yeah, we want to know whether our surgery have good follow-up.
When do you first diagnose the disease?
Sorry?
When do you first diagnose the disease? I mean, you're looking for signs of to allow an early diagnosis of the problem.
Yeah, the problem is some patient we diagnose in neonate, but some of them is in the elementary school.
To identify a way of early diagnosis of the disease, you need to have some patients who don't express the disease at all.
Yeah.
They're not diagnosed already because you want to identify an early diagnosis.
Yeah, correct.
So my question really relates to what sampling procedures are you going to use to test on a population of people so that you can actually identify that you have the signs which allow you to give an early diagnosis?
Okay. So by knowing the genotype of the parents and the patients, then we will make a risk stratification. Okay. Patient have kind of sign and symptom of his plume.
Okay,
Yeah.
thank you. That clarifies it for me.
Okay.
But I think in the rewrite of all of this, as you develop it further, you need to clarify that point very simply, so that we all have an everybody that's doesn't know about Hirschsprung's disease needs to know, when you're going to do the studies and so on in relation to each patient. Another question I had was, how does an EEG tell you about the enteric nervous system?
Maybe Dr. Asmedi, regarding EEG question.
The Hirschsprung related to nutrition or developing of the birth for the infant, then I think I would like to know whether this pathogenesis is not like that, it's not correlate. Yeah.
So actually, this is our new hypothesis, sir. Yeah, we want to know really whether the enteric nervous system doesn't relate to central nervous system.
I'd suggest you put it up as a hypothesis and you're going to test it, but I think all of the things that you put forward as what you want to do are all relevant. I was only concerned mostly with the timing of when you're going to analyse these patients, etc. One other thing, I just wondered whether it's possible to get ethical approval for your study before you get the funding for it. In other words, you talked about 8 or 9 months of waiting for ethical approval after the funding has been approved. Can you start the ethics approval process a little earlier than when you've lodged the application for the funding, so that as soon as you get the funding, you can get on with the study? So I'd suggest
for your suggestion.
have a think about doing that. But also, congratulations on building on your international collaborations. That's a very good idea. Great.
Okay, thank you very much.
Yeah, just one short. Do you have any thoughts on potential funders for this kind of project? Because you have experience, you have had some projects before.
Yeah, I think as you already mentioned in our previous discussion, that if we involve United States, then we will have chance to get an NIH grant, right? Isn't it?
Yeah. We need a partner in the US.
Yeah.
So I'd go through John Hopkins and go for NIH funding. Yeah, absolutely.
Thank you.
But if the disease prevalence is high,
very high,
then Gates Foundation is also worth going for.
Okay, thank you.
Okay, thank you. Applause for this group.
The title of project, development of integrated of palliative care management in Sarjito Hospital. Yeah, since more than 60 of patients come in end stage by 2008, the integrated palliative care with a high quality standard is needed, including hospital and community-based service. Yeah, the practical establishment of palliative care unit that manage terminally ill and life-threatening patients with high quality standard. This is the specific objective to estimate the economic burden and prevalence of terminally ill patients, to assess requirement to establish high quality palliative care unit, to identify basic knowledge of healthcare provided about palliative care, including doctor, nurse, physiologists, dietitians, physiotherapists, family caregiver, etc. And then to improve human resources and infrastructure for palliative care unit, to develop an integrated system for home care, community and hospital care that employs web-based platform. And then the develop palliative care unit in Sarjito. This is the indicator. When prevalence of terminally ill in end-stage patient. And then number 3, dissemination of questionnaire for human resources in Sarjito Hospital to assess the knowledge about palliative care. Number 4, workshop. This is held to improve the knowledge and to standardize the clinical skill in palliative care. Then two doctors are trained for fellowship in palliative care, and 3 nurses from each ward. And then set up palliative care unit. Next. Integrated IT system with web-based platform. With easy use interface for community, and establish palliative care unit, including ward, family caregiver, and recreation area, etc.
But because the way it is presented, it is more focused on setting up maybe a unit in a given hospital. So if I have to respond this as a vice dean, I would just say I'll talk to your hospital director. Think about developing this further and talk to the governor, trying to get the local funding, even to international, because I don't think this system exists in this country. So I see a bigger potential, but we need to broaden the ideas to think bigger, and then I think it would be more interesting. The other thing is, just to clarify, are you proposing to setting a new unit at the hospital, palliative care unit as a new unit, or perhaps you can clarify on that?
Okay, right now in Sarjito, spirit in H department, yeah, in surgery, in obstetric, and obstetric and gynecologists, ENT, etc. So we use same standard.
So this is more of having a standardized system for palliative care, regardless whether the palliative care is delivered by each department or each unit. But you want to have a standardized system. Yeah. How much money are we talking about?
Not yet calculate.
Don't worry.
Don't worry. Don't worry.
It's only 2 years, you know.
Because if it's only, I don't know, 50 million, I could just ring the hospital director. Maybe they'll get it done. Yeah, but IPAC project, integrated. Yeah. But I think this is very interesting. Yeah. Okay.
Can I ask who is on your team? Who is going to actually do this research project?
This is the teams. Representative from nurses.
Okay, don't worry about who they are. What expertise do they bring to the project?
Okay, I'm from anesthesiologist for pain management.
Yep.
And then by you, ophthalmologist, yeah, ophthalmologist, and then Ari, gynecologist, and Vina, internist, yeah. Then Tia, cardiologist.
Okay, any nurses?
Very strong.
Yeah, nurses, good. Any health economists? Not yet. Okay, this is an area that you need to strengthen in the application, is to engage with people in the economics faculty at your university so that they understand health economics, and the administrators on board, and presumably local government and even health department people on board on this project. Because if you don't have their support, this is not going to go anywhere. So I'd be working very hard in the formulation of your application to add to this list of people who are the collaborators, and get those people as collaborators on the project, and get them to support it as well as the university supporting it. So that's one point. The other point is that I agree very much with what Adi said in terms of improving the scope of this project, because if you move from a single hospital to a set of, let's say, 10 or 15 hospitals running your program, the health economists might actually be able to say that this will actually reduce the costs overall. okay, of the program. So that could be an incentive for a funding agency, is that you want to develop a program for implementation in a hospital, you want to see how it works and how well it runs, and then you want to implement that in a range of hospitals in the same area to see what the cost benefits can be. In other words, expand the horizon. It's a good idea, and it's obviously a need for it. So take this step as being step one, but then do a bigger study as step two.
We need one bold volunteer. Okay, thank you. Before you ruin the mood of the Vice Chancellor.
So we decided to choose this title, Improvement of Quality of Life based on Local Wisdom Community of Kampung Wisata Komodo. So our project statement is, in order to achieve international standard for tourist destination, by the year 2020, the project aims to improve Kampung Wisata Komodo community quality of life in terms of sanitary, reproductive health, and infection control based on local wisdom. So our project goal is to improve Kampung Wisata Komodo community quality of life to achieve international standard for tourist destination. So our objectives are that by the end of 2020, we want to improve sanitary, to achieve better reproductive health status, and to control TB infection. The indicators for each objective, for our first objective, we want to assess the availability of standardized sanitary facilities, and to achieve better reproductive health status, we want to achieve the controlled birth rate and decrease maternal death rate. While for the later objective is to control TB infection by having a lower incidence of TB infection and higher compliance of TB treatment. Our last objective is actually to develop human resources and infrastructure in Kampung Wisata Komodo, so that we want to have 2 PhD students for MSCs and 20 undergraduates. In the discussion, we try to seek approval by having protocols, informed consent, and ethical approval. We want to get approval not only from local and national, but also from WHO, as Kampung Wisata Komodo is one of the World Heritage. And for study site preparation, we will start by recruitment of staffs, human resources, and later on transport arrangement, and later on field studies. I think probably Dr. Wahyudi can add things for this.
Sure, the workshop participants would be very happy we could have the second workshop in Komodo Island in this project, and also having people from more of the anthropology and tourist research area, sociology involved on board on this. But I still need to be convinced of what is the research itself that you want to develop. For example, when you mentioned one of the objectives is to improve, was it sanitary? Sanitary, isn't it?
Quality of life.
One of the objectives, improve sanitary. Yeah, improve sanitary. If I try to link this with the quality of life, maybe what you meant is not just sanitary facilities, but actually for Kampung Wisata, then we need to create an atmosphere where the people are very, very good at hygienic and sanitary practices. So not just facilities. Yeah, maybe that's my first comment, and I will add more comments after Alan's comment.
Yeah, thank you. I agree with Adi. This is like it's an intervention in an area. The research question about the effectiveness of different already planned interventions to improve sanitary conditions, to improve reproductive health. Are you wanting to implement that in a new way, or is this environment particularly difficult and therefore needs a different approach, and so what you want to do is apply a new approach to developing these things? So I think that's like Adi, that's my question here is, if you want to find some funding for research, then the question I think needs to be expressed differently. But if you're wanting to find money to actually implement and make change, then this may be expressed okay. Okay, so I think we just need to clarify what is the purpose of this study and who's going to fund it, because it may not be a research funding agency that would fund it, it might be an implementation agency that would fund it. So I think a little bit more thought needs to go into the purpose of this application in broad terms, basically.
I don't know exactly what sort of approval you can expect to get from a multilateral of that sort. So, that needs to be clarified, I think.
And I presume it wouldn't be an application to UNESCO from Gajah Mada University. It would be an application to UNESCO from the government. But you would be the driving force behind the team which would make the application. But the application would have to come from the government. So therefore you need to speak to the government about the idea about improving this environment, and that a longer term outcome of that improvement in quality of life will be an improved opportunity for tourism. That's an important link to make, because the funding agencies will be interested to know what is the long-term benefit of the research that you want to do. And yes, tourism is going to be important in this environment, because that will lead to economic improvement, which can feed back into improved quality of life. So yes, it's important to make the distinction, but I think in this application it's a very big step to take to say we want to improve quality of life for tourism. I would rather you say we want to improve the quality of life to get better population survival, improved sanitation, etc., etc. But then at the last point you say, in the longer term this will lead to opportunities for increased tourism and economic benefit in the society there. Okay?
Yeah, great.
So you have to design a research project about how are you going to investigate ways to improve the quality of life.
Probably Dr. Wahyudi want to add?
Oh no. It's hotel.
Where's the Komodo?
No, no.
Where's the Komodo?
Yeah, it is hotel. Yeah, we go atasnya Mbak, atasnya. Ya, atasnya lagi Mbak. Ya.
Ternyata dia.
Yeah, we live before we go to Komodo Islands. We live in hotel. Hotel is very different with Komodo Islands. It is destination, so we can show how in Indonesian quality life like this, like Santosa Island, like Langkawi, like Klompen apa mana? Volendam, like Volendam, like this. But in no, not yet. Yes.
Well, I think for the research project we're talking about today, there really does need to be the involvement, again, of economists, public health officials, local people, local government people, the community on the island, etc., they need to be engaged in this research project, in community development project, yeah. But with a health emphasis, because that's the fundamental which underpins everything, is getting a healthy society there.
It was quite something that you managed to produce something like this in the limited time and pressure. So let's give another applause for all of you for having this. And as a reward, you will have lunch. But as a bonus, the Vice Dean is inviting everybody for dinner tonight at Jimbaran restaurant. So if you can make it and you're available for dinner, at early dinner, 5 o'clock, so after the course. So if you're available and you would like to join, please tell Mbak Laras so that we can confirm who's going to be there and who won't be there, okay? So during lunch, just think about it while you have lunch and then let know Mbak Laras whether you will have dinner with us or not. So now we have lunch break for 1 hour and then we go back for more interesting sessions on mentoring with Osa and Pa Doni. Okay, see you in 1 hour.